Florida is in bad shape. We are unfortunately seeing the numbers skyrocket here. And in particular, it's the test positivity rate, the percentage of tests performed that are positive, that is deeply concerning. You normally want that number to be below 5, but I'll tell you that where I am in Miami-Dade County right now is as far as recently as a week ago, we had test positivity rates that surged above 30%. That's unheard of. That is an extraordinarily high number. And what that tells us is that the amount of infection in the community is quite significant and that it is in fact growing. So there are measures that have been taken in some counties. In Miami, for example, there is a mandatory mask order to wear masks in public. They've also taken some steps to close down bars and indoor restaurants. But those measures need to be taken across the country. And unfortunately, what we're seeing in the case of Florida is that we're still waiting too long here.
I mean, specifically, I remember in Lombardy in northern Italy, when the hospitals got overwhelmed, that's when mortality really spiked. Here in New York City, we came close to that, never quite hit. Is that a possibility in South Florida in the coming weeks?
Well, we certainly hope it won't get to that, but yes, that is a possibility. We have seen hospitals and ICUs fill up in many parts of Florida, including here in Miami, Florida. And there's a lag between these different events when it comes to COVID-19, and that's really important to understand. First, what happens is people go out and they get exposed, and then sometime after that, some period between 2 to 14 days, people will develop symptoms, and after that, they will go to get a test. They may have to wait several days, sometimes up to a week, to get the test results. Then we'll see ER visits and hospital stay rates go up. And then after that, a week or two after that, we will see death rates go up. So there is this long lag that happens. And even a few weeks ago, people were saying, oh, this isn't that serious because deaths are continuing to go down. But what many of us recognized and what had been talked about for weeks was that those deaths were going to go up. And that's what we're unfortunately seeing now.
We've had a number of days of well over 10,000 cases in Florida, which is a number of days of well over 100 deaths. But fortunately, that death rate is nowhere close to what we had in the New York City broader metro area. Are older people just being a hell of a lot more cautious because they know better at this point? What's your view?
Well, I think there are a few things that are going on in our favor. I think one is that there is more awareness that this is a serious issue and that it's particularly concerning for those who are elderly. And so I do think people who are older, many of them are taking more precautions than perhaps they were in March. I think we also know more about how to handle this virus when it comes into the hospital. We've recognized, for example, that using high flow oxygen as opposed to intubating early is a better strategy. We have dexamethasone, a steroid, which we now understand can be helpful for reducing mortality. We have remdesivir, which doesn't necessarily reduce mortality, but reduces hospital stay. So we do have a few more tools, nothing that's a game changer, but a few more tools. But my concern is the following. Unlike what happened in March in New York, we are now seeing rapid spread in many states. So not just a couple, but in Florida, Arizona, Texas, South Carolina, Southern California, and the list goes on. What we're also seeing is that even though there's a greater portion of young people who are affected now, and even though young people have fewer complications than older people, although not zero complications, that will ultimately, unfortunately, change because the more younger people get affected, the more older people they will expose. Unfortunately, though, what I worry about, Ian, is that we're not still heeding many of the lessons that we learned from New York. What New York taught us is the following. It said that we've got to make sure that our hospital systems have the equipment, the materials, and the support in terms of person power to ensure that they can handle a surge. Today, we are still seeing hospital systems across the Sun Belt in the country that are struggling without protective equipment. We also learned from New York's experience that testing is critical. See, testing is like our eyes. It's what lets us see where the virus is. And if we can't see, we can't contain the virus. We can't contain it, it will continue to spread.